Further debate. I recognize a member from the PN Carleton.
Thank you very much, Speaker. It's my pleasure to rise in debate today for Bill 84, the Medical Assistance in Dying Statute Law Amendment Act. Before I start, I do have some good news I would like to share with the Assembly. As many of you know, I put forward a private member's motion last fall for a compassionate and catastrophic care fund for the province of Ontario. And earlier today, there were many people here from CORD Canada fighting for rare diseases, but it wasn't just rare diseases, it was those also for exceptional circumstances in healthcare. And one of the big champions of that piece of legislation, or that private member's motion, was a mayor from Trent Hills named Hector McMillan. And Mayor Heck had to travel to Germany to get life-saving surgery, and the OHIP panel here in Ontario was giving him a very difficult ride, but he did nevertheless fundraise for those initiatives and for that surgery, went to Germany, and just an hour ago contacted me to say he has no cancer left in his body. Wow. So medical advances, of course, Speaker, are everywhere, and I want to congratulate Mayor Heck not only for being cancer-free, but for being a fighter, because if it were not for his work, the government would not be, I don't think, exploring the possibility of bringing the nano-knife to the province of Ontario. And unfortunately, he wasn't able to use it here, but he will hopefully save other lives, and that brings me to this particular bill, Bill 84. It has been stated many times in this Assembly that, pardon me?
Order, please. Order, please.
You know, you can't share good news around here, Speaker, without Liberals wanting to take credit for it. The reality here is that this is effectively a process piece of legislation. Speaker, you know, the reality is the Liberals are over there. You can't even agree with them, and they have to heckle you. You can't even suggest that you're supporting a bill of their own, and you can't even share good news in here without them playing these stupid games. I watched it in question period this morning. I'm watching it again on the floor of this Assembly. They should be better than that, Speaker. We're really getting tired of it. Again, you can't agree with them without getting heckled. Maybe they don't have much to do, and this is what the backbenches over here are relying on, are for you know, the future government of Ontario to stand up and then get heckled by them. But let's nevertheless get back to Bill 84 for the first time in the last 3 minutes to talk about this, with hopefully without any heckling from the other side, so I may be able to complete my thoughts. Here we go, Speaker, seriously. So in all seriousness, we have declared the support for this resolution, and I'll tell you why, Speaker. The bill is here to provide clarity for and legal protections for the healthcare professionals and organizations that provide access to what's called MAID services in Ontario in accordance to federal legislation, Bill C-14. So I think it's important for us to note at this particular time that this legislation isn't about whether you support assisted dying or you don't. That decision was made by the federal government, and in particular by the Supreme Court of Canada at a time a few years ago. So what we're actually doing now is in the words of our critic, Jeffrey Urick, we're just providing clarity. We're cleaning up some of the loose strings that were left with the federal legislation, as well as the decision by the Supreme Court of Canada. And so in accordance with that ruling, the federal government did pass legislation on June 17th related to medical assistance in dying, and as a result, we now have a regulatory health professional colleges that will provide guidance and regulations regarding medical assistance in dying. This is a specific issue for a specific problem that was created as a result of legislation providing clarity. This happens all the time, and that's why we're dealing with it. But one of the things that we hear time and again, and I do have a letter in my desk from one of my constituents, is the concern that those who believe that medical assisted dying should be accessible for those who qualify and want it without forcing institutions and healthcare practitioners to act against their beliefs. And that's a consistent piece of concern. Whether I agree with it or not is is totally irrelevant. I think that the reality is when you look at healthcare professionals and practitioners, they are actually asking for this, as are many patients. So Ontario's regulations, in our opinion, must ensure a balance between individual rights, including recognizing the conscience rights of healthcare practitioners and facilities, while also protecting vulnerable individuals. We believe there's a path forward, as other provinces done. Notably, I would like to point out Alberta, to ensure that our healthcare system respects all perspectives on this issue. It is an issue of personal morality, and that is something that is very difficult to legislate, Speaker. So we respect the conscience rights of professionals. Just to point out that back in February of 2015, just to give you a sense of the history of this, the Supreme Court of Canada struck down the criminal code that would prohibit those seeking assisted dying. And the court determined that a competent adult like you or myself who would consent to end their life through what would be apparently a terminal medical condition would be allowable. And I know this had a robust conversation and debate in the federal House. In fact, I remember at the time, very courageously, the former MP and cabinet minister from Manitoba, who is now a sitting member of the legislature in Manitoba, Stephen Fletcher, talking about his views in a very personal way after an accident that he had sustained that made him a quadriplegic. And I think that many of us in this Assembly probably do have very personal views. And I say this, Speaker, as someone who has lost her father and has watched him suffer. And I don't know if this would have been something he would have chosen to do in the ending days of his life, but I do know that we in our family really relied on the palliative care system in Nova Scotia. And if I may say so, Speaker, as we do talk about dying with dignity and dying with feeling like you have some control left in your life, the palliative care system in that province was quite remarkable. In fact, I would then, after coming back from my father's funeral, decide that I wanted to get to know a little bit more about Ontario's palliative care system. Now, this was a decade ago. I was elected 11 years ago, and I can say, Speaker, through you, that we do have a remarkable healthcare system in the dying days for those in palliative needs and hospice care, and it is in no small part not due to government funding, but due to the people that have the most incredible bedside manner, whether that is a palliative care nurse or a palliative care doctor or other people who work in those units. When I saw it with my own father, those who choose to spend their career caring for the terminal are indeed angels on earth. And so too the palliative care nurses and doctors and orderlies and those people who are at places like Briere or Ruddy Shankman or anywhere else in the province, my heart goes out to them because they are very strong and angelic at the same time. Now, not every family, given the new assisted dying legislation, will choose to continue with palliative care if they can choose to terminate their life and die by assisted suicide. And so that brings a number of different, I think, conundrums to play. And it's very important that not only are our patients given the appropriate pain medication, the appropriate relief and the appropriate care, but it's also important that we consider the needs of our healthcare professionals in the province of Ontario. And I know that there are some who do object to providing this type of assistance in order to terminate a life. And the Progressive Conservative Caucus feels that there needs to be a process in place in order to protect those people. And that's why our critic, Jeffrey Urick, will be making an amendment that would protect those rights and but allow those who are seeking to die by assisted suicide to pursue that. One of the biggest champions on assisted dying was Dr. Don Lowe. he died of a brain tumor, and many people may remember Don Lowe from his advocacy for assisted dying. And he made national headlines as he died on this issue, and his wife Maureen Taylor spoke to our parliamentary committee, and she was also the co-chair of the Provincial Territory Expert Advisory Group on Physician-Assisted Dying that was set up by our government. He at the time gave an emotional plea on YouTube. Sorry, Maureen Taylor was Don's. Okay, I've got this a little bit wrong. Yeah. Yes. Okay, so I'm just actually going to get this right. Maureen Taylor spoke at the committee and was the co-chair of the Provincial Territory Expert Committee group, and it was her husband Don who passed away from a brain tumor, and it was he who gave the emotional plea. Now, I want to quote what she said at committee speaker, because I think for a woman who has gone through what she's gone through, to appear at committee was quite remarkable, but also to have such a balanced view I think is appropriate for us to discuss in the House. So she said, quote, "I want to stress too that I totally support the rights of individual healthcare practitioners not to participate in assisted death if that goes against their conscience." And I think it speaks to the balance that we're looking for on this side of the House, that even though there are strong advocates across the province of Ontario for medical assistance in dying, that there are also strong advocates within that area that support the conscience rights of Ontarians who may be involved in healthcare. And that's why I think it's important that when we reach out and we speak to organizations like the Canadian Medical Association, who also has a policy to support those who provide medical assistance in dying, and also those who do not. Apparently, from my research, they have advised the College of Physicians and Surgeons to revise their effective referral approach, and the College of Nurses of Ontario also calls for the medical assistance in dying to allow nurse practitioners and physicians to administer medications to cause the death of a client. There's a great deal of research out there, particularly by many of the big stakeholders. The Canadian Medical Association's policy is to support those who will choose to participate in MAID and those who will not, medical-assisted dying. I think that their position articulates a duty that is widely and morally acceptable, and that allows physicians to act as moral agents without in any way impeding or delaying patient access to assisted dying. And they support the freedom of conscience. And I think I heard from the minister today that he was pleased not only to receive the support of most members of this Assembly, but also he recognizes that this is a consistent and recurring theme in many of the discussions that we have had. It is always about a fair and balanced approach, particularly as we talk about morality and what people are comfortable with their own conscience. And the Canadian Medical Association will further say that their effective referral approach, the CPSO, is encouraged to support the creation of systems and resources that would facilitate access to those seeking MAID services. I just mentioned the College of Nurses. They also recognize nurses' freedom of conscience, and we were fortunate here, Speaker, last week to have our NAO here talking about some of the challenges in our healthcare system and what they view in terms of moving forward. I didn't have the opportunity to speak to them about Bill 84, but we did have a long-ranging, far-reaching discussion on some of the challenges that are faced today in our healthcare system, and it just goes to show you how complex this actually is. You know, they would probably point out the nurses, College of Nurses in Ontario, that the legislation doesn't compel an individual to provide or assist in MAID, but the nurse's conscience objection must not be directly conveyed to the client, and their personal judgments regarding belief, lifestyle, identity are not to be expressed to the client. And I would agree with that, Speaker. I think that you know, my personal choice, if it were to choose to die by medical-assisted suicide, I think that I would want to have people around me that would support that decision if they were trained professionals, and those who had those strong feelings, you know, perhaps they shouldn't convey those to the patient. in which case that would make for, I think, a great deal of trauma for the patient. And again, we all have different views, and we all have different ideas. We all have different expectations of life and death. And I, for one, wouldn't want to tell anybody how to live or to die. That's obviously a choice that the Supreme Court of Canada allows us. The College of Physicians and Surgeons of Ontario effectively talks about this effective referral. And I just want to point out, this has come up a number of times in this Assembly over the last 11 years on a variety of different topics within the medical system. But effective referral basically ensures that a patient is connected in a timely manner to another physician who is not objectionable, and that would provide accessibility to the patient. And an effective referral doesn't guarantee a patient will receive treatment, but it does ensure access to care and demonstrates respect for patients. Healthcare, which is an organization, agrees with the bill, but are seeking an amendment for conscience right, and they propose that the conscience rights, they proposed something at the committee. The OMA supports a patient referral option in addition to clinician referral services. The OMA doesn't support CPSO's effective referral policy. The Registered Practical Nurses Association didn't propose amendments, but their principal concern remains how MAID will impact the quality and funding of Ontario palliative care services, which, Speaker, as I just spoke about, I think is incredibly important, that as we have this debate and we talk about medical assisted dying, and I probably have the terminology wrong, Speaker, because I think it probably evolves to be a bit more sensitive than perhaps it started out with. So I want to say that as much as I respect those choices, I also respect those choices for people who want to die naturally, but with the support of a palliative care hospice unit. And it's one of those things. Again, I know for a fact that palliative care, particularly in a terminal patient, won't save someone's life. As much as I had hoped when my dad was getting chemotherapy that it was palliative chemo. It wasn't shrinking his tumor. It was maintaining at least some semblance of life for him. Particularly in the last 6 weeks of his life, and he stayed with us until he could, and it is an option that we use as family members and as people in order to, after we've exhausted all of our options, in order to keep our loved one with us as long as we possibly can. And so I certainly respect the Registered Practical Nurses Association of Ontario. So this is effectively sums up Bill 84, medical assistance in dying. And it ought not to be controversial because, again, we are prescribed by the Supreme Court of Canada to accommodate this. Therefore, the question becomes, as we do that and as we tie up those loose ends that have been left to us by the federal government and the Supreme Court of Canada, is then we have to have that discussion about those people who are either comfortable or not in performing this activity. And I think that there needs to be that sensitivity, and I believe in my heart that when we put forward our amendment that the government will beat us to it and they will respect what so many of their stakeholders are saying, what their expert, Dr. Don Lowe's wife had said, and I want to get her name out there one more time because I think it's rather important. Her name is Maureen Taylor, and I think that when you look at that, Speaker, that we can strike a balance that allows us to meet our statutory obligations while at the same time understanding that there needs to be a balance for the conscience of the people of this province. So thank you very much. I appreciate that.